Hi, everyone. Thanks for joining us for this workshop. Our topic is From Emergency Authorizations to Permanent Reform, Healthcare After COVID-19. The COVID-19 crisis has intensified the spotlight on all kinds of cracks in our healthcare system and in other systems too. Now, what did all levels of government end up having to do to meet the crisis? In a lot of cases, they actually had to get out of the way is what they had to do. They had to remove regulatory hurdles that prevented our healthcare facilities and private enterprise from responding. So if those emergency measures to reform healthcare policies were effective in response to the crisis, it kind of begs the question, should these reforms be made permanent? And that is our topic for today. We have three wonderful panelists with us, speakers today. And I'm going to just very briefly introduce them. They have a more full bio on our website that you can take a look at. We have Stephen Anderson with us. Stephen is president and CEO of the Pacific Legal Foundation, which litigates cases nationwide to vindicate the rights fundamental to a free society. We have Kathleen O'Hearn. Kathleen is Senior Director of Policy Advancement at the State Policy Network. She leads their policy team, which works alongside state-based think tanks to identify key policy reforms and come up with some very highly innovative solutions. And we also have with us George Coates. George is board chair of the Commonwealth Foundation in Pennsylvania. He is a member of the Philanthropy Roundtable and a board member of Donors Trust and also Americans for Fair Treatment. Welcome to all three of you.
Welcome.
So what we're going to do in this session is actually a little bit different than what we've been doing in some of the other sessions today. This is a workshop for a reason. We're hoping that you will be able to be a much more active part of the conversation and have a chance to really dive into some of the questions that you're thinking about. So we're going to have each of our panelists provide about 5 minutes of opening remarks to help set the stage. And then from there, we will move into separate breakouts with each one of them. Each of them will be hosting their own room where we hope you'll have a chance to ask them any questions, be part of a conversation, mics off, everyone talking, and that the three topics will be ones that you're interested in really learning much more about. Stephen will be covering, and he'll tell you much more in his opening remarks, but he'll be covering litigation angles on this. Kathleen will be covering policy angles, and George is going to be talking about philanthropy's contributions and based on his state experience in Pennsylvania. So three very different aspects of the bigger topic around permanent deregulation. So that's our plan. And we are going to start with those opening statements. I'm going to call on Stephen first, and then we will take it from there. So Stephen, why don't you join us and share a little bit about your thoughts?
Great, thanks, Debbie. Philip Truesdale is an emblematic example of American entrepreneurship and healthcare regulation gone wrong. When Ohio was closing a local power plant, Philip was looking around for something he could do to provide for his family. He saw an ambulance for sale on the side of the road, purchased it, and is now providing ambulance services throughout Ohio and now supports his family through that. One of the things that Philip would like to do is take his clients from Ohio into Kentucky, allow them to go to their appointments, and bring them back from Kentucky to Ohio. But he's not allowed to do that. And why? Because of a healthcare regulation known as a Certificate of Need law. These laws are essentially competitors' vetoes, which allow Philip's ambulance service competition in Kentucky to petition the state government to prevent him from going into business. It's blatantly unconstitutional. That's why we've filed a lawsuit in federal court in Kentucky to vindicate Philip and his family's constitutional right to earn an honest living. We see public interest litigation as a very important means of social change. In fact, it's very American. Even more, it predates when America was America. The first known public interest case in the United States was in 1761. In fact, a young John Adams watched that case and said, that's the day that independence was born. Of course, we all know about the successes of groups like the NAACP and the ACLU in the 20th century. And I'm proud to say PLF is one of dozens of free market litigation shops that try to vindicate the right to individual liberty. But in order for litigation to provide permanent change in the regulatory environment, it has to be part of a long-term and integrated strategy. And the reason that is because what we're trying to do through litigation is to strike at the very heart of government's ability to regulate at all. We're trying to rebalance the fundamental relationship between man and the state. Now, I will say that a crisis is not necessarily the right time to bring great public interest cases, and there are two very important reasons for that. The first is we've seen what has happened over the past 6 months. There have been hundreds and hundreds of cases that have been brought against government for what is done in response to coronavirus. And we've seen nearly every single one of those cases fail, because typically they're one-off cases, not part of a longer-term strategy. And in times of crisis, what you'll see is judges just defer to what the legislature or the executive has done. You'll also see the circumstances changing very rapidly. We've seen this here at PLF. A number of cases that we were on the precipice of filing or even have filed have now gone away because circumstances have changed so quickly as the virus has mutated, as the response by government has mutated, and it prevents us from bringing those cases. What we need to do is make sure we're bringing the right cases at the right time with the right plaintiffs, because that's what's going to win out in the long term. The other part of the reason that crises are not the greatest time to bring public interest suits is because we're still dealing with jurisprudence from the last great crisis during the Great Depression. Some of the cases that we're fighting against date back to the 1930s, to the switch in time that saved 9. There's a reason that this week at Amy Coney Barrett's hearings, you saw Sheldon Whitehouse go off unhinged about what the Supreme Court might do. Like it or not, the Supreme Court has a great deal of impact on the future of our society. We choose this method of social change because we believe that there are 3 co-equal branches of government. In fact, the whole reason that PLF was started was because of Ronald Reagan's situation in the 1970s in California, where he was being bombarded with what were left-wing public interest groups. So we see that there can be great success through the courts. Now, while this might not be the right time to bring lawsuits, I'm still optimistic about bringing lawsuits against the conditions that allow government to regulate in the way it does now. But we need to be methodical and look over the horizon. And I look forward to discussing more of these strategies in our breakout session. Thank you so much.
Thanks, Stephen. Really appreciated hearing your perspective on litigation, not just today's crisis, but sort of what underlies the importance of public interest litigation. I want to bring Kathleen up now to talk about policy and very similar topics, I'm sure. But Kathleen, what's the policy angle on all this?
Absolutely. Thanks, Debbie. So in March, probably like a lot of you, I was really overcome with this feeling of despair, of a lot of uncertainty around when coronavirus hit our shores and the country began to shut down. But I do remember that first moment, I had a little bit of hope. And it's when I saw a picture of Georgia doctors sitting on a plane bound for New York City, which at the time was the heart of the pandemic. It's where all the scary stories were coming from. And while I was mostly seeing like terrible story after terrible story in the news, it was a little bit of a beacon of hope. And the reason it gave me so much hope was not only seeing, my fellow citizens rise up and do what was important at the time, which I think we saw a lot of that in those early days, but it was a beautiful illustration of how policy impacts lives and how this network and how the work of the state think tanks that we work with day in and day out actually do change lives for the better. Because the only reason those doctors could board that plane, take that picture, making the iconic heart symbol because they were on a Southwest Airlines flight, was because New York got rid of its antiquated licensing laws that said you have to have a New York license to practice in New York. This was something that the network had advocated for years, and that was just a small example of things that planes of doctors flying all over the country. And I know we are all very familiar with an experience, probably firsthand, all the government overreach that has happened in this the past several months. And there's still a lot of that going on. But the headline that has been buried maybe in like page 10 of the newspaper is really significant, is that there's a lot of deregulation that happened via the states this year in the name of the pandemic. And healthcare in particular, which we're here to talk about today, 40 states, I like to say that number again because it's like mind-blowing to me, 40 states took action to deregulate their healthcare delivery systems, especially in telemedicine, just using your phone to talk to your doctor, and licensing, which allowed those Georgia doctors and hundreds of other doctors to go across state lines during the early stages of the pandemic. SBN, we started our healthcare working group about 10 years ago. And if you remember, 10 years ago is when we got the ACA. And a lot of people, especially on the right, kind of gave up and said, okay, healthcare is done, not much we can do. But we at SBN, we believe that states can and absolutely should be a mechanism for change in healthcare. And when the pandemic hit, that working group was able to look over years of solutions and identify the top 5. I'll put a link to the chat where you can see some of what those solutions are. That were ideas that we've been fighting for years that really would help increase access, make it more affordable, and create a better experience for all of us as patients. And I tell you, we did some research around this because we saw this action happening. More states took action in 17 days at the end of the March than has happened in the past 10 years combined. It was a windfall. And I hope that inspires you as much as it does me, because it's a demonstration of how much opportunity there is in the healthcare space right now. And yes, Obamacare is still the law of the land, but what I'm saying is we have an alternate pathway where states can rise up and show a different way, a better future. States can lead the way to actually providing what everything the ACA promised, right? More affordable healthcare, more accessible healthcare, and a better, easier experience for all of us. I don't know how many of you, I know me in particular, it was the first time I used telemedicine ever during the pandemic. And a lot of that is because states took laws off the books that were regulations impeding it. And I, for one, don't want to go back. And I know a lot of people don't want to go back. SVN is really doubling down here because there's so much opportunity in this space right now. In a lot of areas, we've seen this disruption happen that Debi mentioned earlier. And there is an opportunity for us in the idea space to show a different way, more so maybe than there ever has been, and not only in healthcare, but in education and regulations around starting small businesses. So SVN is launching what we're calling our Make It Permanent campaign alongside the Healthcare Working Group, just to make this massive amount of deregulation permanent. Now, earlier I mentioned that 40 states took action to deregulate their healthcare system, which is amazing. But there's a kicker, there's a catch. I feel like, isn't there always? Almost all of this was done during states' declaration of emergencies via executive action or via governors taking action. And like milk, it will have an expiration date when state declaration of emergencies close or when the governor says, okay, we don't need this anymore. And this is why it's going to be so critically important to make these deregulations permanent in 2021 legislative sessions, put them into law, because I'm a big believer we cannot lose the momentum we have right now. We have gained so much this year, and there really is an opportunity to show this country a different way how healthcare can operate via state action. So I'll leave it there, and I'm looking forward to talking to everybody in the breakouts.
All right, Kathleen, thank you for setting the context, and for I'm excited to actually follow the permanent deregulation work that you do at SPN. That sounds fantastic. Let's bring George on, and George is going to be covering sort of the philanthropic contributions to this whole scenario, and also drawing from his experience in Pennsylvania specifically, where there has been action. So George, why don't you join us?
Indeed. Thank you so much, Debbie. And let me say that having had the pleasure of working with you and Elise in your prior roles at the Snyder Foundation, it is my pleasure to be back here and working with you both again at the Philanthropy Roundtable. Steve and Kathleen, it's great to be with you. Welcome to everyone who's attending. Impact philanthropy, which is that which seeks to affect an outcome or change an existing circumstance, is traditionally a highly strategic pursuit. From accumulating the treasure that makes philanthropy possible to identifying areas of interest and opportunity, crafting a mission statement to pursue those opportunities, defining and refining donor intent so that other family members, board members, and staff can execute the mission faithfully, all takes strategic planning. But in times of crisis, private philanthropy can also be remarkably and tactically nimble, and in ways that neither government nor institutional charity can mirror. On a grand scale, we can see this in the remarkable gifts of the Bill and Melinda Gates Foundation, pledging hundreds of millions of dollars to quick start vaccine research in response to the COVID-19 pandemic, a move which no government agency, academic research institution, or healthcare company could have matched for speed or level of resources committed. On a smaller scale, Donors Trust, which many of you know, and Debbie mentioned it, but in the interest of transparency, I do sit on that board. Donors Trust launched the Growth and Resilience Fund in July, seeding it with internal capital, which in turn attracted a quick and enthusiastic response from the larger philanthropic community, eager for effective ways to respond to the pandemic and the ensuing erratic government behavior. In a matter of weeks, phase one of the fund made 17 grants totaling over $800,000 to mostly state-level entities working on both healthcare reform and economic recovery, all projects of merit. But those 17 projects were selected from over 100 proposals. 100 proposals submitted in very short order to address immediate opportunities for reform. And in this, I think Kathleen and I are in absolute agreement that the environment right now is so ripe for opportunity. So in other words, across the country, the folks who fight for regulatory reform on an ongoing basis do see that moment of opportunity. As the Growth and Resilience Fund enters phase two this fall, the focus will shift slightly to partnering with public interest law firms across the country, like Stevens, in an effort to make permanent regulatory repeals enacted during the crisis and to prevent the opportunistic implementation of new regulation in a time of uncertainty. In Pennsylvania, the Commonwealth Foundation raised over $250,000 incremental dollars in the late spring and early summer to run an issues campaign raising awareness of Governor Wolf's draconian response to the pandemic and the ensuing shutdown, and to highlight the regulatory hurdles in both healthcare and economic response to the pandemic. Working with the state legislature, Commonwealth Foundation was able to move a bill enabling the expansion of telemedicine through both houses at record speed. They're also currently working to reduce the regulatory stranglehold on healthcare worker certification and licensing, which is the principal impediment to allowing healthcare workers from around the country to concentrate in states of need as the pandemic ebbs and flows, and as Stephen talked about. The Texas Public Policy Foundation has launched an even more ambitious multi-pronged strategy to address healthcare regulation reform at both the state and federal level, including telemedicine and licensing reform, but looking across the spectrum of healthcare regulations to streamline access to care and maximize resources. And this effort is mirrored all around the country, as the actions of governors like Wolf in Pennsylvania, Newsom in California, Cuomo in New York, mayors like Bill de Blasio in New York City, or our own dear Jim Kinney here in Philadelphia. They have all raised public awareness of the entanglement and burden of the regulatory state to a new height, particularly as it relates to healthcare, business, and employment. Efforts by the Illinois Policy Institute, the Yankee Institute in Connecticut, Pelican in Louisiana, Beacon in Tennessee, so many others, state-level think tanks and public interest law firms all around the country are seeing this moment of public awareness to educate lawmakers and enact reforms. I opened using the term impact philanthropy, which to me is philanthropy which seeks to affect an outcome or change an existing circumstance. As a society, we are not back to normal by any stretch of the imagination, but we have to a certain extent settled into a new routine. As the philanthropic community, like others, regains its footing, as we rock from our heels back onto our toes, I believe there is a unique opportunity to invest in reform across the country. Regulatory reform is a dry phrase that often fails to engage the average citizen, but so many have been negatively affected by the nature of the government response to the pandemic that for the moment that has shifted, creating an opportunity that I believe is for real and lasting reform. And as we kind of move into the open discussion format, I would love to hear from those attending what areas of opportunity interest you and where you think those opportunities lie. Debbie?
Thank you, George. So we have three different perspectives on the problem. And we were just looking at the number of people who are here for this and making in the background, having some conversation about how we can have the best conversation. And we're going to scrap the original, let's have three different breakouts and bring everybody into one group and stay here. So we heard from three of our experts. We have a litigation expert, we have a policy expert, and we have George, who bridges both through philanthropy and through his active support of activities. And he raised the issue of impact investing. So we've got a few cameras turned on. I'll encourage people to turn their cameras on one more time. And let's just open a conversation. So George invited the group to raise ideas that they have. And just before we do that, I'm wondering if our experts could comment on this. Seems like the situation was we had an emergency, just to kind of summarize it. We had an emergency that led the government to think, what do we need to do to be able to respond more effectively? They realized what they needed to do was remove some barriers. That would seem to be a very obvious reason for permanent deregulation. And I wanted to get all three of you to weigh in terms of why hasn't it become obvious? Why do we need to have a permanent deregulation campaign? Why do we have to worry that some of these regulations will come back on the books? So I want to start there. Why is this even a problem?
Well, maybe I'll start, Debbie. I'm fond of the quote, the natural course of things is for liberty to yield and government to gain power, right? We're dealing with human beings here, and once they have a modicum of power, they want to utilize it. What I will say is, in the litigation context, that the very fact that the sky hasn't fallen because of the deregulatory activity that has happened provides us greater evidence when we're in court as to get away from the justifications that the courts will often use to just rule in favor of the government. When I was talking about the last crisis, the jurisprudence we're still dealing with from there, what the courts did is they bifurcated our rights. There are some rights that we have, namely First Amendment rights, that get great protection by courts, and there are all the rest of our rights, particularly economic liberty and property rights, that get short shrift, and it's known as rational basis review, and that's what we're fighting against. And what we were trying to do at PLF is get courts to understand that we can start bringing in evidence in these lawsuits to show that that the justifications that they're making are not actually, there's no means ends fit. And while some of these initial cases have not been successful, what I think the deregulatory environment will be very helpful, because we'll be able to point very specifically to some of these laws and say, nothing bad happened when you increase the scope of practice, or you allowed cross-border licensing, that kind of thing.
Thanks, Stephen.
The one thing I would add to that is not only did nothing bad happen, actually great stuff did happen, right? People, even personally, I was like, wow, I had a doctor's visit, I got a prescription, all like in 5 minutes. That was amazing. And so I think we have to tell the stories. It's not only nothing bad happened, but great stuff is happening. And this is what could happen even more, right? Our healthcare system in particular is so just burdened by unnecessary regulations in a lot of sense. So I think right now we have to tell the story. And I think a big reason that it went through now and maybe has had a hard time in the past is like a lot of the arguments that the people who are against this, which usually are rent seekers. So, Stephen mentioned certificate of need laws. Hospitals don't like certificate of need laws because it brings in the competition. We always like to call it's certificate of need laws, or giving your opponent a veto, an official veto. And so I think a lot of them, they didn't really have a leg to stand on. They were like, well, yeah, we need this. And so we have to do the job of telling the stories of why it's working and why it's actually helping lives and livelihoods, to show that they don't have a leg to stand on either during normal times either.
Yeah, and I think in terms of good benefit, I would actually, moving away from the economic and healthcare side, you choose a much more frivolous example. In Philadelphia, between the Pennsylvania Liquor Control Board, which is very authoritative, and a highly corrupt and entrenched license and inspections department in the city of Philadelphia, restaurants are very tightly curtailed. This was a great example to me of what happens when you push all of that government out of the way. And suddenly restaurants are spilling out onto sidewalks. They're using common spaces. They're allowed to continue with their business in ways that they never, ever would have been allowed to. And it's wonderful. It leads some normalcy to the pattern of life in the city. And it's very effective. And we'll see what happens with that as time goes on. I think the single most important practice for making regulatory reform permanent after litigation is public awareness. As I mentioned, most people, if you say, hey, I'd like to talk to you about state level regulatory reform, they sort of go, no, don't want to talk about that. Being able to raise these issues to the point where people understand how it intersects their lives. And a lot of people have gotten a crash course over the last 6 or 8 months on how these regulations intersect their lives in ways that they never have before. And they have a very different opinion on some of this regulatory structure. The more that we can spread that message, the more that we can make people aware, I think that's how we make it permanent.
I have one more question, and I definitely want everyone to jump in with their thoughts and their ideas. So George, is this now a bipartisan push? So if people are looking at regulation in a whole new light because of what happened with COVID, are we seeing more pockets of support across a wider spectrum?
I think you're seeing more pockets of support across a wider spectrum within the populace. But within the mechanics of government, it remains a highly partisan issue. The Commonwealth Foundation was able very effectively to both help write and then marshal through the State House and the State Senate very quickly a reform bill on telemedicine. Our governor vetoed it. In the middle of the pandemic, he vetoed it. And it left a number of major medical institutions across the country when fielding telephone calls from Pennsylvanians saying, we don't think we can help you. We don't think we can legally take this call. That was not in fact the case. And as Wolf so often does, he came back and actually enacted it via executive order, having made the great public grandstand of having vetoed it. He got his political credit, and then he solved the problem that we solved for him. So I think in that sense, it comes back to the issue of awareness. It comes back to just educating both the lawmakers and the population about the importance of making these reforms permanent.
Kathleen or Stephen?
I would say, like, we did some research. I put a link up in the box. If you look at some of the maps where this research came from, like New York was one of the states, and part of it because they had such a big problem early in the pandemic that took the most actions to deregulate. So it's a great demonstration of when there is a need, like left, right, it doesn't matter. You got to take action. And I think there's probably more opportunity than ever, especially in blue states, to talk about deregulating some of these long-term healthcare regulations that really are antiquated at this point, like telemedicine. So yeah, I think there is a big opportunity in the blue states, especially because a lot of times they had some of the worst laws. So they made the biggest jump, they made the biggest leaps, and their citizens are all now experiencing that. Right? They've got on their phone and like, wow, this is much better than going to a waiting room and getting coughed on for 2 hours. So I think there's some definitely leadway in blue states, because you saw some blue states, New York in particular, take pretty significant action.
Yeah, Debbie, I actually don't know the politics necessarily of any of the clients that we have. And I'm struck in this conversation by a very poignant remark that when I used to work at the Institute for Justice, one of its first clients was a African hair braider in DC. And what he said was, I didn't know what I was fighting for, but then you came in and you put a name to my cause. And then all of a sudden it was very empowering. And I think a lot of people don't understand why is it that they can't get into business? What is it that is suppressing them? What is it that is disallowing the kind of things that George has said, the creativity that's been unleashed when you deregulate? And I think the more we can do that, we have to do this with judges. The reason I started with a story is because you have to choose clients that are going to get a judge to go just a little bit farther than they have before, because they're going out on a limb. You're asking them to do that, and they want to do it because there's a human face in the courtroom, right? It's not this esoteric principles of the Constitution. It is Philip Truesdale and his family can't put supper on the table because ambulance companies in Kentucky have the ability to stop them from doing that, and that's just, you know, that will hopefully get judges to say, you know, that's not right.
All right, well, we've got lots of people in the room, so I'm going to encourage you just to speak up. I have a feeling that we can do this pretty organically and not trip over one another, but you can either wave at me if you have something you want to ask, or just unmute your mic and raise your questions. We got a policy expert, we got a lawyer, and we got a philanthropist slash active board member who's, I know George he's very active in Pennsylvania and does a lot as a board member. So Jeff, did you have yes, Jeff, please go ahead.
Yes, I'm Jeff Grebe with the Murdoch Trust. We found that there was some, actually in Alaska, dental practitioners were allowed to practice, and in general, dentists oppose this because it took some procedures out of theirs. So where in this whole regulatory scheme do come some of the medical groups? You know, you talked about hospitals that want to keep another hospital out, but how does that fit into this regulatory balance and the political issue? Because I know in many states, this is not allowed, right? For simple medical procedures. Alaska, they did it because in some of the remote areas, people would have to actually get on a 4-hour airplane flight to go to the dentist. So it was a practical issue there that doesn't apply in some other areas. But we did run into some of these things as other states are trying to expand it in our 5-state area, which is basically the Northwestern states.
I think that's the scope of practice issues were pretty pervasive, and there was a lot of action taking. A lot around, particularly during the pandemic, was a lot around what pharmacists could do around testing, and it's only recently that pharmacists could even give flu vaccinations. So it's definitely an area to get a lot of ground. It's one of the hardest areas to actually make a dent, though, because it does have some pretty powerful opponents. I mean, you named one, like American Dental Association, or basically these associations that represent doctors or hospitals. They have normally been against it with the argument that you're going to see more errors, you're going to see more harm to patients because of this. So it has definitely been, it's the number one reason more scope of practice reforms haven't passed, and it's because there is a very powerful industry behind it that doesn't want an expansion or kind of expanding out scope of practices to other industries or to people. And all we're saying and all the reforms are saying are, you got to be able to practice to the top level of your abilities. In a lot of instances, that's not allowed. It's so important in rural states. It's such a critical issue.
Jeff, let me add to that, if you don't mind. In addition to certificate of need laws, the other biggest weakness we see in the short term on healthcare regulation is scope of practice. We're actively looking at a case, it's either in California or Arizona, on teledentistry. And the arguments that we plan to make are very similar to other arguments we make within PLF on separation of powers, and whether the definition of dentistry or however they're being regulated within the state goes beyond the scope of what the legislatures allow these regulatory bodies to do. But as a result of a Supreme Court case a couple of years ago that came out of North Carolina, there's also antitrust concerns that we see. So we do think that may be a way to get in the short term to try to deregulate things like dentistry.
Can I add to this question just a little, Jeff? We have somebody, George was in the alcoholic beverage industry, I think is the way you would describe it, right? Are there parallels? It seems like that's another industry where there are lots of arguments for why it should be regulated, or concerns and opponents to deregulation. Are there any lessons that we can draw from that industry?
Well, it's an interesting practice. It's an interesting case of not updating your circumstances. So beverage alcohol, which is probably the most regulated, most taxed industry in existence, is a federally mandated 3-tiered system, and you're only allowed to participate in a single tier. So you can either be a producer, you're a distiller or a winemaker, whatever it may be, but you produce some sort of product. You can be a distributor, or you can be a retailer, but you may not occupy 2 or even 3 of those spaces. And the reason was, on the heels of Prohibition, when the mob controlled a great deal of the alcohol production, it was to separate them out of the business. So you couldn't control distribution and production at the same time. Of course, each time you roll through one of these stages, the tax burden is enormous. I mean, a bottle of vodka that you pay $20 for on a retail shelf costs the manufacturer about $3 to make. They make about another $3 on it, and the other $14 that is on that bottle are taxes. So I think you could revise that structure. It's time probably to refresh it, and I think that's a great example for regulations across the board.
Restructure. All right. Thank you. That was an interesting question. All right. Thanks, Jeff, for that question. Other thoughts? Or I know George was also interested in hearing what your ideas are for deregulation and regulation. I'd love to hear them too. I know it's Friday afternoon.
Well, while we're waiting for that, Debbie, I do
Yes.
want to make one point that maybe wasn't clear, but I do want to make explicit, is that I think all the strategies we've talked about today are necessary. I think it's a coordinated thing. You know, we've seen litigation lead to legislative change, and so I think we're all working in parallel, just with different strategies. But I do want to let folks know that it's not an either or; it's a yes and kind of situation.
Mm-hmm. That makes sense, the strategies. And I'm wondering, the flip side of some of these questions is, what is there actually a case for regulation? I mean, we're talking about deregulation, but within healthcare, what is the strongest case for regulation? What kinds of things do we think actually might be properly regulated? I want to turn it over on its head and get your thoughts. Probably start with Kathleen because she's policy person.
So it's a great question. So I would say in all these areas, there is a string of regulations that could be argued for, right? In telemedicine, you do want to make sure that people are opting into it and that there is a good relationship established. Scope of practice, you don't want to have like people saying, I can do this, I can perform surgery on you without any kind of licensing at all. You want, I think, me as a consumer of healthcare, I want to know that there has been some checks on that. I don't think I would want to know. I don't think I would want to go into a healthcare situation with somebody I didn't know went to medical school and had some sort of validation of that. But so I think in that for sure, because healthcare is at the end of the day about life and death, which is pretty important, right? And in terms of do no harm, that's a very important thing we have to stick with. So I think there, of course, when it comes to safety of patients, we have to have some regulation. But right now, the industry is such that a lot of these regulations, they're not about safety. They're about protecting the interests of specific parties. And people fight against them, not because it'll hurt people, but because it would hurt their bottom line.
Any other thoughts, George and Stephen? And I just realized that people have been writing in the chat and I've been immersed in the conversation, missing the stuff in the chat. So yes, George and Stephen, any additions to what Kathleen said?
Yeah, I mean, this is not an area of expertise for me, so I don't have a lot to say, but it seems to me that Kathleen kind of nailed it, which is you can look at this set of regulatory issues and divide it into 2 camps. There are those that involve certification of practitioners and involve patient safety and involve cleanliness and hygiene and drug supply and all the rest of it, where the government absolutely has a regulatory role. The portion of it that infringes on the business and the economics of healthcare is an entirely different story. And that's where I think it should be stripped out as much as possible.
I'll make a plug for private regulation as opposed to government regulation.
Yeah.
But one of the difficulties, of course, is that healthcare regulation hews as closely as you can get to the government's police power to protect health and safety. So that's why it just all gets really twisted up, and that's what the interest groups will say is no, this is health and safety. This is why we're doing this. When the evidence doesn't bear that out. It's protectionism, not health and safety. But that's the hue and cry you're going to hear from the other side is this is a legitimate power of government, and that's what we're utilizing.
When you say, go ahead, Kathleen.
Oh, I would say like the Mercatus Center actually did a study to show if certificate of need laws, which you mentioned earlier, Stephen, if there actually was like any kind of correlation around safety or well-being of patients, and they found none. Actually, it was the opposite. When there is more con laws, there tend to be more incidences of issues. So it's a really good study. I can find it and put it in the chat. But it basically showed that this is not about safety because the evidence and the research isn't there.
Okay, all right. Well, Stephen, yeah, that's interesting. Stephen, you mentioned private regulation. You really mean the industry policing itself or creating the standards for itself. I mean, in a way, that's what we do in philanthropy for the most part. We are self-policing. Is that what you mean by private regulation?
Well, yeah, I just didn't want to, I had to give the Robert Nozick version of what regulation should look like. So I just want to plug that. Just because it is so difficult to draw the line between health and safety, what the legitimate police power is and what folks in the halls of legislature are arguing about.
Yep, that makes sense.
There's more being the devil's advocate, I guess.
Right, right. Okay. So we have some questions here, and one is about the insurance companies. Insurance companies are huge in the healthcare space. Where do they stand on this issue of deregulation? Are they for regulations? Are they against regulations? They play a huge role in the system.
Well, I mean, I think if Obamacare showed us anything, they can be for regulation because it makes payment easier. You have large scale providers. You don't have to deal with a bunch of different solo practitioners. There's consolidation in the business world, and I think that so they invariably would like that. Because it makes their lives easier.
Yeah, I think in the most instances, it depends. Like in telemedicine, for instance, a lot of times they're for regulation because it makes the payment really easier, which is their bottom line. And like some issues, they're on the sidelines. They're not as engaged in like scope of practice or maybe like certificate of need. They don't have as much a dog in that fight. So they tend to get involved when it's regulation around the payment pieces. I mean, they are definitely very engaged in the surprise billing conversation and anything related to telemedicine, because a lot of that comes down to how does the payment transfer from insurance to a provider, and what does that whole system look like? So that tends to be where they get engaged. But I think overall they tend to be more on the regulatory front.
Now, believe it or not, we're actually at our time, which seems like we just got started. But I want to squeeze in for like a very rapid response, a question about right to try laws and whether you have any thoughts on whether the pandemic is a classic opportunity to make inroads there. Like a very quick couple of seconds, sentences answer. Right to try.
Yeah, I mean, I think it's been a remarkable opportunity to showcase the ability to make that decision as an individual. And I think the president actually did that himself last week.
Yeah, I would echo what George says. I mean, it's made incredible progress. It's one of those, I love this policy because it's something that bubbled up from the state and forced the federal government's hand. And especially because the heart of that was just showing how onerous some of the regulations around the FDA are. And we're entering this world where we need a vaccine, right? We gotta get back to normal, and that's going to require speeding some of that up. And the FDA is notoriously slow and notoriously has a lot of regulation around it. So I think they're very hand in glove, because that's going to be a key thing about getting us out of the coronavirus.
Stephen, any last words?
Well, we're suing the FDA right now on a separate issue. So anything that gets their hands out of things is a good thing for me.
I love that. Stephen's always, that's the first one. We're suing them. So, all right. Well, thank you, everyone. This actually went by much faster than I expected, and I hope we got a chance to answer your questions. I was not that great at scrolling down the chat at the same time as being involved. Thanks for joining us.
Thank you.